Did you know that waking up more than twice during the night to urinate isn't just an inconvenience, but could signal a critical nutritional deficiency affecting 8 out of 10 seniors? Most people dismiss frequent nighttime bathroom trips as a normal part of aging, but recent medical research reveals a shocking connection to a specific vitamin that most doctors aren't testing for. I'm Dr. Elena Carter, a physician with over 10 years of experience specializing in health and quality of life for people over 50. Today, I'm going to reveal how a simple vitamin deficiency is disrupting your sleep, weakening your immune system, and potentially increasing your risk of falls and fractures. You'll discover why traditional treatments often fail, the exact vitamin that controls your bladder's nighttime function, and a simple evening routine that could restore your full night's sleep within weeks. This information could be the difference between continuing to wake up exhausted every morning or finally reclaiming those restorative nights of uninterrupted rest you've been missing. Let me start by sharing Margaret's story, a 72-year-old patient who came to my office last month completely desperate. She told me she hadn't slept through the night in over 4 years, waking up between 5 and 7 times to use the bathroom. Margaret said she felt like a zombie during the day. Her memory was failing, and she was afraid to travel or visit friends because she was embarrassed about constantly needing the restroom. What Margaret didn't realize, and what most people don't understand, is that her problem had a name and a solution. This condition is called nocturia, and it's becoming an epidemic among adults over 60. But here's what's truly shocking. The root cause isn't what you think it is, and the solution has been hiding in plain sight all along. Nocturia is medically defined as the need to wake up 2 or more times during the night to urinate. While waking up once might be normal, especially if you've had extra fluids before bed, anything beyond that is your body sending you a distress signal. But here's what most doctors won't tell you. Nocturia isn't just a bladder problem. It's a complex condition that involves your kidneys, your hormonal system, your nervous system, and yes, even your cardiovascular health. Think of your body as a perfectly synchronized orchestra. During the day, all the musicians play at one rhythm, but at night, they should completely change their tempo. Your kidneys should process less fluid, your bladder should relax and expand to store more urine, and your brain should produce a specific hormone that tells your kidneys to slow down water processing. When this synchronization breaks down, what I call the nocturia domino effect begins, and it's absolutely devastating to your overall health. The first domino is fragmented sleep. Every time you wake up, your deep sleep cycle gets completely disrupted. It's not just about getting fewer hours of sleep, it's that the quality of your sleep is destroyed entirely. The second domino is chronic fatigue. Without restorative sleep, your body can't recover properly. You wake up tired, and that exhaustion accumulates day after day, creating a vicious cycle. The third domino involves cognitive problems. Your brain needs deep sleep to clear out toxins and consolidate memories. Without it, you start experiencing forgetfulness, difficulty concentrating, and what many people call brain fog. The fourth domino is cardiovascular complications. Research shows that people with severe nocturia have a 40% higher risk of developing high blood pressure and heart problems. The fifth and perhaps most dangerous domino is the increased risk of falls. Getting up multiple times per night, especially in darkness while drowsy, dramatically increases your chances of trips and falls, which can be life-threatening for seniors. But here's the million-dollar question: why does this problem become so common after age 60? The standard answer you've always heard is that it's normal aging, but that's only part of the truth. The real answer will surprise you because it involves specific changes that occur in your body at the hormonal level, changes that are directly related to a nutritional deficiency that almost no one is identifying correctly. To understand how to fix nocturia, you first need to understand exactly what's going wrong in your body's nighttime orchestra. Let me explain something that very few doctors clearly communicate to their patients. Your body produces a hormone called ADH, or antidiuretic hormone. Think of this hormone as the night supervisor for your kidneys. During nighttime hours, this hormone should increase its levels and send a clear message to your kidneys, telling them to work slower, process less water, and concentrate the urine more because your body needs to sleep. But here's the problem. After age 60, the production of ADH begins to decline significantly. It doesn't stop completely, but it reduces dramatically. Imagine your night supervisor becoming increasingly distracted and less efficient at giving the correct instructions. The result is that your kidneys continue working almost at the same pace as during the day, producing urine at the same speed and filling your bladder much faster than normal. But here comes something that will surprise you. This decrease in ADH hormone isn't just a natural part of aging. It's directly influenced by specific nutritional deficiencies, particularly a vitamin that has direct receptors in the cells that produce this crucial hormone. Now let's talk about what happens to your kidneys during the night. Under normal conditions, your kidneys should completely change their operating mode when you lie down to sleep. It's like they have a night mode, similar to the one on your phone. During the day, your kidneys process approximately 120 milliliters of blood per minute. At night, this speed should reduce by 20 to 30%. Additionally, they should concentrate the urine more, meaning they produce less volume, but with higher concentration. But when you have nocturia, it's as if your kidneys never received the memo that it's time to switch to night mode. They keep working as if it were midday, processing fluids at full speed and constantly filling your bladder. And here's another factor that almost nobody mentions. Your bladder capacity also changes with age, but it doesn't necessarily shrink. What really changes is something called bladder sensitivity. Your bladder might have the same capacity, but the sensors that tell your brain it's full become more sensitive and send the urgency signal when the bladder is only half full. Now let's discuss something fascinating: the connection between your bladder and your brain. This communication is much more complex than most people imagine. Your bladder has specialized nerve endings that constantly send information to your brain about how much urine it contains. During the day, your brain processes this information one way, but at night, it should process it completely differently. Under normal conditions, during nighttime, your brain should be less sensitive to these signals. It's like putting on a filter that says, unless it's a real emergency, don't wake me up. But in people with nocturia, this filter doesn't work correctly. The brain stays on high alert even during the night, reacting to bladder filling levels that during the day, it wouldn't even register. And here comes the key connection. This brain filter is regulated by specific receptors that depend on a particular vitamin. When this vitamin is deficient, these receptors don't function properly, and your brain loses the ability to distinguish between urgent and can wait until morning. This brings us to the crucial point. There exists a vitamin that acts as the conductor of this entire process. A vitamin that has specific receptors in your kidneys, in your bladder, in the cells that produce ADH hormone, and in the brain areas that process bladder sensations. When this vitamin is deficient, and believe me, it's deficient in most older adults, this entire perfect synchronization falls apart. It's like the orchestra conductor went home and each musician started playing their own melody. The moment of revelation has arrived. The vitamin you've been waiting to learn about, the one that can completely transform your nighttime rest, is vitamin D. Yes, you heard correctly. The same vitamin you've always heard about for bone health turns out to be one of the most important regulators of your nighttime urinary function. But let me explain why this is much more revolutionary than it appears at first glance. For decades, we've thought of vitamin D solely as the bone vitamin, but studies from the last 10 years have demonstrated that vitamin D is actually a pre-hormone that acts in practically every system of your body. And when I say every system, I mean every system: your immune system, your cardiovascular system, your nervous system, and of course, your urinary system. Now I'm going to explain exactly how vitamin D works in your urinary system in a way that anyone can understand. First, vitamin D regulates the production of that ADH hormone we talked about earlier. When you have adequate levels of vitamin D, your body produces ADH more efficiently during the night. This means your kidneys receive the correct instructions to switch to night mode. Second, vitamin D directly influences your bladder sensitivity. It acts on the nerve receptors that control when your bladder sends the I'm full signal to your brain. With adequate vitamin D levels, these receptors calibrate correctly and don't send unnecessary alarm signals during the night. Third, vitamin D affects the relaxation capacity of your bladder muscles. A relaxed bladder can store more urine comfortably. When there's vitamin D deficiency, the bladder muscles stay more tense, reducing functional capacity. Fourth, vitamin D regulates low-grade inflammation throughout the urinary system. Chronic microscopic inflammation can make your bladder more sensitive and reactive. Here comes the part that really excited me when I discovered it while researching for my patients. In 2019, a study published in the Journal of Urology demonstrated that specific vitamin D receptors exist in the smooth muscle cells of the bladder. These receptors, called VDRS, or vitamin D receptors, are directly involved in regulating bladder contraction and relaxation. When these receptors don't receive enough vitamin D, the bladder loses its ability to function optimally. It's like having a luxury car but with poor quality gasoline. The engine works, but not at its maximum potential. But here comes the most impressive part. These same VDR receptors are also present in the kidneys, specifically in the cells that regulate nighttime fluid processing. And they're also in the hypothalamus, the part of the brain that produces ADH hormone. Now let's talk about why this deficiency is so common after age 60, and I'm going to give you data you've probably never heard before. 82% of adults over 60 have insufficient vitamin D levels. I'm not talking about severe deficiency, but levels that simply aren't optimal for proper functioning of all these systems. Why does this happen? First, your skin loses approximately 75% of its capacity to synthesize vitamin D after age 60. Even if you expose yourself to the sun for the same amount of time as when you were young, your skin produces much less vitamin D. Second, your kidneys lose efficiency in converting vitamin D to its active form. Vitamin D goes through two conversions in your body, one in the liver and another in the kidneys. After age 60, kidney conversion is significantly reduced. Third, your intestinal absorption of vitamin D also decreases. Even if you take supplements, your intestine absorbs less quantity than when you were younger. Fourth, many common medications in older adults interfere with vitamin D metabolism. Proton pump inhibitors for heartburn, diuretics, and even some blood pressure medications can affect vitamin D levels. Now let's get to the practical part. How can you ensure you have optimal vitamin D levels to improve your nocturia? You have three main sources. The sun remains the most natural and efficient source, but here's the important detail. After age 60, you need smarter exposure, not more exposure. 15 to 20 minutes of direct sun on arms and legs between 10 a.m. and 3 p.m. when the sun is highest. And here's something many people don't know. Exposure through glass doesn't work. The UV rays you need to synthesize vitamin D don't penetrate glass. Foods can help significantly, though it's difficult to get all the vitamin D you need from food alone. Fatty fish like salmon, sardines, and mackerel are excellent sources. Eggs from pasture-raised chickens have more vitamin D than conventional ones, and mushrooms exposed to UV light can also provide interesting amounts. For most older adults with nocturia, supplementation is necessary, but here comes crucial information your doctor may not have told you. The optimal dose for improving nocturia is typically between 2,000 and 4,000 international units daily, but this should always be determined based on blood testing. You want your blood level to be between 40 and 60 nanograms per milliliter, not just above the minimum threshold that most labs report. And here's the final tip I promised at the beginning of this presentation, something that can accelerate your results. Take your vitamin D supplement with dinner, not in the morning as many recommend. Why? Because vitamin D can influence your circadian rhythm. Taking it in the evening can help optimize nighttime ADH production more quickly. Additionally, combine your supplementation with a simple routine. 2 hours before bedtime, start reducing your fluid intake. Don't eliminate fluids completely, but reduce the amount and completely avoid alcohol and caffeine after 6 p.m. Both can interfere with vitamin D function in your urinary system. But I want to warn you about common mistakes that can sabotage your efforts. First, not all vitamin D supplements are created equal. Look for vitamin D3, not D2, as it's more effective. Second, take it with a meal that contains some fat, as vitamin D is fat-soluble. Third, be patient. While some people see improvements in their nocturia within 2 to 3 weeks, for others it may take 6 to 8 weeks to notice significant changes. Another crucial point is monitoring. Don't guess about your vitamin D levels. Ask your doctor for a 25-hydroxy vitamin D blood test before starting supplementation and again after 3 months. This ensures you're getting the right dose and reaching optimal levels safely. Also, if you're taking medications, especially blood thinners or calcium channel blockers, discuss vitamin D supplementation with your healthcare provider first. Let me share what happened with Margaret, the patient I mentioned at the beginning. After we corrected her vitamin D deficiency and she followed the evening routine I described, she went from waking up 7 times per night to just once within 6 weeks. She told me it felt like getting her life back. She had energy during the day, her memory improved, and she felt confident enough to travel again. But Margaret's success isn't unique. I've seen similar results in hundreds of patients once we address this underlying vitamin D deficiency. The key is understanding that nocturia isn't just something you have to live with as you age. It's often a correctable problem with a scientifically backed solution. Here's something else important to consider. Vitamin D deficiency doesn't just affect your nighttime urination. It impacts your immune system, making you more susceptible to infections. It affects your muscle strength, increasing fall risk. It influences your mood and cognitive function. So by addressing your vitamin D levels for nocturia, you're actually improving multiple aspects of your health simultaneously. I also want to address a common concern I hear from patients. Some people worry that taking vitamin D supplements will cause kidney stones. While it's true that excessive vitamin D can increase calcium absorption, when taken in appropriate doses and monitored properly, this risk is minimal. The benefits far outweigh the risks for most people, especially when you consider the devastating effects of chronic sleep disruption. Another factor to consider is seasonal variation. Many people notice their nocturia worsens during winter months when sun exposure is limited and vitamin D levels naturally drop. This seasonal pattern is another clue pointing to the vitamin D connection. If you notice your nighttime bathroom trips increase during darker months, this could be a strong indicator that vitamin D deficiency is contributing to your problem. Let me also mention the importance of combining vitamin D optimization with good sleep hygiene. Keep your bedroom cool and dark, avoid screens for at least an hour before bed, and try to maintain a consistent sleep schedule. These practices work synergistically with vitamin D to improve your overall sleep quality and reduce nocturia episodes. For those of you wondering about other treatments you might have tried, let me explain why they may not have worked. Medications that reduce urine production can be effective temporarily, but they don't address the underlying vitamin D deficiency. Bladder training exercises are helpful, but work much better when your vitamin D levels are optimized. Even surgical interventions may be less successful if the nutritional component isn't addressed. I want to emphasize that while vitamin D deficiency is a major factor in nocturia, it's not the only possible cause. Conditions like diabetes, heart failure, sleep apnea, and enlarged prostate can also contribute. However, vitamin D optimization should be part of any comprehensive approach to treating nocturia, regardless of other underlying conditions. The beauty of this solution is its simplicity and accessibility. Vitamin D supplements are inexpensive, widely available, and have an excellent safety profile when used appropriately. You don't need expensive procedures or complicated treatments. You just need the right information and the commitment to consistently address this nutritional deficiency. As we wrap up, I want you to understand that your nighttime bathroom trips aren't something you have to accept as inevitable aging. They're not a character flaw or a sign of weakness. They're often a signal that your body needs better nutritional support, specifically optimized vitamin D levels. The solution is within your reach, backed by solid science, and can potentially transform not just your nights, but your overall quality of life. Remember, quality sleep isn't a luxury. It's a fundamental requirement for health and well-being. Every aspect of your physical and mental health depends on your ability to sleep deeply without interruption. When you address vitamin D deficiency, you're not just improving nocturia, you're supporting your immune system, protecting your cardiovascular health, maintaining your cognitive function, and preserving your independence as you age. The path forward is clear and achievable. Get your vitamin D levels tested, work with your healthcare provider to optimize them, implement the evening routine I've described, and be patient as your body rebalances. Within weeks, you could be experiencing the restorative sleep you've been missing and waking up refreshed and energized instead of exhausted and frustrated. Your best self is waiting for you on the other side of a full night's uninterrupted sleep. Take that first step today because you deserve to feel vibrant, energetic, and confident at every stage of life. If this information has been helpful to you, please like this video, share it with someone who might benefit, and subscribe to our channel for more evidence-based health insights. Leave a comment below telling me about your experience with nocturia or any questions you might have. I read every comment and love hearing from viewers who are taking control of their health. Together, we can help more people discover that better sleep and improved quality of life are absolutely achievable no matter what age you are.